Hello, everyone. This is our next topic in our initiative that we have started in this YouTube channel. So, today I want to talk about a very common neurological disease in our entire world, and this is Alzheimer's disease. Many people thought that Alzheimer's disease is just it happens in the age of the elderly people, and it is all about uh, forgetting things. Many people thought like this, but it's very far from that. So today we will look in detail about this Alzheimer disease. We'll try to see some knowledge based information, how the elderly people can be aware of their health, and we will try to empower the youth, and we'll see some real impact projects. So please be in touch until the end of this video. Advanced Alzheimer's disease. Comprehensive insights, awareness, and impactful empowerment. Medical knowledge, health awareness, and youth empowerment. Okay, 1. Medical foundation. Deep dive into the pathophysiology and progression of Alzheimer's disease. Clinical progression stages. Moderate dementia stage. Individuals lose track of their location, the day or the season. Confusion depends as they may mistake family member or wander away in search of familiar surrounding. Key care requires assistance with daily activity like dressing and grooming to ensure safety and hygiene. Severe or late dementia stage. Communication is limited to fragments of words. Physical capabilities decline sharply, leading to rigidity, loss of swallowing ability, and total dependency. Not only this, there is also some impacts that came along with being elderly. Terminal impact. The brain loses ability to control vital functions, eventually leading to death due to complications like pneumonia. Pathological hallmarks, plaques and tangles. Alzheimer's is defined by the accumulation of abnormal protein deposits. Beta amyloid plaques form outside neurons, disrupting cell-to-cell signaling. Meanwhile, tau protein tangles accumulate inside neurons, collapsing the internal transport system or microtubules necessary to neuron delivery. This toxic combination triggers neuroinflammation and massive synaptic loss. The shrinking brain. In this disease, scientists has analyzed 140 gram is estimated to be an average brain mass loss. Severe cortical atrophy. In advanced stages, the damage is visible to the naked eye. The cerebral cortex shrinks, especially in the hippocampus area responsible for forming new memories. Ventricles or fluid-filled spaces in the brain grow larger as brain tissues are lost. This structural collapse correlates directly with the decline in cognitive and motor function. We know that brain has cognitive and motor function. So therefore, the advanced stage of Alzheimer's disease will result in the structural collapse, which directly correlates with the decline in cognitive and motor function in the brain. Managing advanced symptom. How to manage this advanced symptoms. Neuropsychiatric support. managing agitation, anxiety, and hallucination through environmental adjustments and specialized medication. Nutritional care, addressing swallowing difficulties, dysphagia, using texture modified diets and ensuring adequate hydration. Mobility management, preventing pressure sores and contractures through frequent repositioning and gentle physical therapy. Palliative care, shifting the focus from curative treatment to comfort, dignity, and quality of life for both the patient and family. So there are four management in the advanced symptom of Alzheimer's. And these are neuropsychiatric support, nutritional care, mobility management, and palliative care. 2. Health awareness, challenging misconceptions and fighting stigma. Global awareness campaign, change the inning. Campaign focus on disrupting the fatalism around dementia, showing that research make breakthroughs possible. Share the orange. Use metaphors to visualize brain weight loss, 140 gram, to help the public understand it is a physical disease, not just aging or not just only forgetting. It can also impact our cognitive and motor function in our brain because, as stated in here, the advanced stage of Alzheimer's disease is the structural collapse, which directly correlates with the decline in cognitive and motor function. Breaking the silence. There is a quote that says, Alzheimer's is not just about forgetfulness. It is a physical disease that steals a person's future, one connection at a time. And if some of us can, or if some of us are able to, then we need to help the elderly in these days. Yeah, we need to help the elderly. Caregivers burden, social and emotional support. Caregivers of advanced patients face extreme emotional distress. Awareness must extend to providing respite care, giving caregiver the time and space to rest. Impact, community-based support reduces isolation and improves the well-being of both the caregiver and the loved ones. 3. Youth empowerment, engaging the next generation of leaders and scientists. Young Leaders WYLD, activating change. The World Young Leaders in Dementia Network empowers students and early career professionals to influence policy and research. Young people are no longer just observers, they're peer educators, stigma breakers, and innovative researchers, tackling the disease from the fresh perspective. So, if the young ones create like this initiative, like the WYLD network, then it also be a successful passion driven project for them for their future. Also, they will impact their community by doing a positive influence in the community. Global Youth Project that we've known is A Million Hand, Project We Forgot, and HFC Universe. In the A Million Hands UK-led project enabling young scouts to learn about dementia and take social action in local community. Project We Forgot, digital community in Singapore supporting young caregivers through stories and peer mentorship. HFC Universe, brain health education for students to learn habits that reduce dementia risk in the future. Impact of youth engagement. The youth engagement in the world, or the youth initiatives, have a positive impact, and the impacts can be placed like this. Their impact in improved stigma perception is 65%, the impact in increased research interest is 20%, and the impact in the general public is 15%, which is a great start. data indicates that targeted youth programs significantly shift social attitude toward dementia care. 4. Real impact project innovation in technology, AI, and personalized medicine. AI and early screening. Predictum. Traditional DX has a 72% accuracy. Expert clinician has an 85% accuracy. AI platform has a 94% accuracy. Impact projects like the Predictum use AI algorithm to screen for dementia from the comfort of the patient's home, significantly reducing the diagnostic wait time. Global research investment. Annual funding for AD research has seen an exponential rise according with the introduction of precision medicine platforms in 2010 to 2025 EST. It's an estimated. Path to a cure. 2024. Blood biomarkers. Widespread adoption of commercial blood tests for earlier non-invasive diagnosis. 2026. AI screening. An integrative AI model predicting disease progression with 95% accuracy. Nowadays, AI is being mm, very common in most countries in the world. So that is helping very much in predicting diseases that are very difficult to predict. 2028 Precision Med, customized therapy targeting specific genetic and microbial pathway, gut brain axis. 2030 Plus, Next Gen TX, advanced drug candidate moving from disease slowing to reversal mechanisms. Okay, this is all about Alzheimer's disease. So if you have any question or any thoughts or any idea, then you can write it in the comment section below. So thank you for watching.